Hello, I am Dr. Samina. I am a general practitioner and I practice in NMC Medical Center Maysaloon, Sharjah. I have more than 13 years of experience in this field and I am here today to talk about respiratory infections. Respiratory infections are illnesses that affect the respiratory system like airways, nose, throat, all respiratory system. The common symptoms of respiratory diseases are cough, sore throat, nasal congestion, runny nose, fatigue, and sometimes signs of breathlessness will be also seen in the respiratory infections. So differentiating between viral infections and bacterial infections can be really troublesome because it's very confusing as the symptoms often overlap. Same symptoms can be seen in viral infections and same symptoms can be seen in bacterial infections. But how do we know whether it is viral or bacterial? So for that we do some lab tests. We do CBC, complete blood picture. So in that we see the WBC count. If it is a viral infection, usually WBC count cell goes down. And if it is a bacterial infection, it will be high. Then we will also see lymphocyte. Lymphocyte count goes usually low in the viral infections. Then there are few swabs which we take, nasal swab we take, and it shows us whether patient is having viral. If any influenza comes, it's viral. Then we take throat swabs for pharyngitis and all, and they come sometimes bacterial or fungal. So these are the things, these are the labs, or these are the ways by which we can categorize between viral and bacterial infections. Also viral infections, they can take 1 week. Within 1 week almost the symptoms go down and the patient feels better. But if it is bacterial, it sometimes worsens and sometimes patient needs hospitalization, as in case of pneumonia with high grade fever and all. Respiratory infections can be transmitted via droplets. Like if a patient is having cough, sore throat and he coughs or he sneezes, those droplets will fall down and it can come into contact with the other person and they can have the same upper respiratory infection. They can get infected by these droplets. Second thing is if a patient he coughs or he touches anything and the other person who is not sick, they will touch the same contaminated thing, they can get the respiratory infection. So it's mainly through droplets, through contact with the sick person. We should seek medical attention while having respiratory infection. If the respiratory infection, your symptoms, if they persist for more than 10 days and your symptoms are worsened, you don't feel any relief within 1 week with the symptomatic treatment that you take at home sometimes, then you should definitely seek medical attention. You should not wait more. Respiratory infections can be prevented by maintaining your hand hygiene. We should wash our hands while eating, and if we come into contact with any contaminated thing that is infected, we should wash our hands. We should use masks. We should be up to date with the immunization. We should take influenza vaccines yearly, and we should not come into contact with the sick person. And when we are sick, it's better we stay at home, we don't go out. So the treatments of respiratory infections depend. If it is viral, we can give proper hydration, rest, and we do labs. And if influenza comes positive, it comes viral, we give Tamiflu, Oseltamivir, this is the treatment for it. But if it is bacterial, we need to give antibiotics. In that case, we start antibiotics. So these are the treatments for viral respiratory infections and bacterial respiratory infections. Over-the-counter medications can help you relieve your symptoms, like for nasal decongestants, they can help in congestion. Antipyretics, they will help in treating your fever for some time. But over-the-counter medications cannot cure the disease. They can only give you symptomatic relief. Thank you so much for watching. If you have any more concerns regarding respiratory infections, you can see me. I am available in NMC Maysaloon, Sharjah.